So dental implants, the cost must come up all the time.
Yeah.
So what determines cost and of an implant or implants?
Well, I mean, there's a lot of different options out there for people. You know, there's everything from mini implants, which we don't really do, but there's pterygoids. So there's a lot of options, honestly. And what I always tell people is this: I offer a consultation. I'm happy to sit down with people. I even do a 3D scan for the patient at no charge, because we basically want to sit down and get to know you and figure out what are you interested in. And it depends on your budget. So there's a lot of different options. It's hard to kind of pinpoint what the cost would be, because someone might need their teeth removed, right? Someone might need, maybe they're interested in a acrylic or porcelain. So there's different materials, different things. So it really just depends on what you're looking for. But we like to sit down, and by the time you leave, you'll have a fee and you'll know what the cost would be. And you can take that around and you know, I stand by what we offer. I mean, we do a great job for people. In a lot of ways, people will come in and see me after they've already gone somewhere, and they stay with us because we treat them well, and they see
you're
that
less than the big guys.
They see that our price is competitive. It's
so the implants themselves, I guess there's lots of different types of implants, as you say. There's different types of teeth that go on top.
Right.
Zirconia,
acrylic, porcelain, those
so
things.
that affects cost. Some people need bone grafting, some people don't.
Yeah. So it's hard to kind of tell someone an exact price if we don't know you.
And that's the challenge, I guess.
Yeah.
So if they come in, you can give them a price.
Absolutely. And you know, again, we'd be happy to sit down with you and look at you, because I kind of look at their individual situation and what we're able to do for them, and then we go from there.
Is this true that some of the Googling, Googling implants, that they're quoting prices of the actual titanium post?
Yeah, and
it's somewhat misleading.
Yeah, see, that can be misleading, and I stay away from that stuff, because again, I want to give you an accurate quote. I want to sit down and get to know you and talk with you.
Do you feel this way? I feel like if they're misleading about one thing, what else are they going to be misleading about?
Right. Like if they're telling you the screw itself is a couple $100, you know, the reality is it's probably going to be more cost on top of that. Okay. When you work with me, I'm going to tell you what's the cost for the whole case. And I really stand by that. If I tell someone that's the fee, I don't want to go back and nickel and dime them and say, well, actually, it's more for this.
Now you teach implant dentistry, so I guess how it's typically done is in two different places. The surgeon does the implants, another doctor puts the teeth on top, then they get them maintained elsewhere. You do both parts.
Yeah, I do both parts.
So is that why you're able to do it like in as little as 2 visits?
Yeah, I work together side by side with some really great labs. They have amazing technology, and even in one day they can come in. We do the procedure, patients relaxed, comfortable, taking a nap, and they get their teeth installed, and when they wake up, they got their teeth in place, and then they're just healing, and in a few, you know, I mean, they can start chewing right away.
Now insurance, because I guess even the best insurance, max payout $1,500 or $2,000.
Yeah.
So it covers very little.
Sure.
Medicare, Medicaid doesn't really cover this at all.
Right.
And you say people are financing this.
Yeah, I mean, insurance doesn't really cover implants. You know, maybe they cover a few things here and there. Like you said, $2,000, and we're happy to work with anyone who has insurance. We do. I have some really fantastic team members, and they're pros at looking at your insurance benefits. And then, you know, a lot of times people look at this like kind of like financing. You know,
they do.
Yeah, oh yeah, absolutely.
Half people finance?
Yeah, what I hear most of the time when people do this is not about, oh, the cost and this. They actually say, well, why didn't I do this earlier? Because now I'm chewing and eating the foods I loved and just smiling with confidence, not worried about my teeth coming out.
Is this true? The most expensive part is going out to eat all the time?
Yeah, probably. I did a case on a wonderful lady not too long ago. I gave her a gift card for a steakhouse, and she hasn't, you know, been able to chew these crunchy foods that she loves. So that's kind of, I don't know what price you can put on that. You know, it's really up to the person, but I hope they really get a lot out of it. That's my hope.